Table 1, you were looking at delayering of management. What can be done to get a better contribution from them?
Thanks. Yeah. Three things. Firstly, we spent time debating the premise. Was the premise correct? Are we actually delayering management? And actually, although it was quite technical, it flushed out that actually a lot of the delayering at the moment is happening at commissioning level in a very visible sense, and that trusts maybe aren't feeling it so hard yet, but our monitor colleagues said that they soon will be. So we accepted the premise that we were delayering, and then one went on to talk about, given that environment, what is it that managers need to be able to deliver in an ever more challenging world. And then we discussed the things you'd expect. People therefore need clarity and purpose, what it is they're there to do, to be motivated, to be supported, to be very clear in terms of what the goals for success were. We talked about how Monitor had been very clear in the past and defined this is what good looks like if you want to be good, and very clear about that. And in one way we were sort of saying more of the same, what we already know about what makes a good organisation, although Richard made the point, given that this is not a benign or a simple environment, that the economy is going to be so challenging, the media attention, the politics around this quite toxic NHS means we'll have to really invest real time and effort and values in this as senior leaders. Then our third point was that as well as doing more of what we already know, we felt that senior leaders are probably going to feel under a lot of pressure in terms of the public attention they'll be given for the decisions they will have to make. And in that environment, people need confidence both in themselves as individuals and themselves as a profession. And that led us back to the earlier conversation about the value of some sort of national approach, whether that be regulation or code of conduct, but something that would help give people support. Toby spoke about some sort of code of conduct that helped you make the hard decisions easily and make the easy decisions harder, but sort of help you through that process. We thought actually that is the logical and mental place that it takes you.
Thank you. So we've got most of the right things in place, we just need to do more of them or do it more assertively. Any other comments on that? Do you think that assertion's right? We heard last week that the Care Quality Commission had gone in and found, I don't know, 100 organisations, 45 they found were okay, the rest were not. Does that suggest that managers are doing the right things?
Actually, I thought the question is what we're going to do then.
Yeah.
So what we're going to do then?
More of the same in terms of supporting people, I think is what they were saying, the mentoring, the training, development, the things that are already there to support managers.
And there's no evidence that's worked, so let's do some more of it, surely. Is that a plan?
So what would your prescription be?
I haven't got one, but I wasn't on that table. That's just
rather than leaving it to individual organisations to do themselves, have some sort of national approach and mechanism, whether it be through a system of regulation or accreditation, to do it.
Absolutely right. They don't work. You know, we have a national code of bloody conduct, but somebody told us we don't have to have it. You know, it's not compulsory. We've got, you know, various other national, like this stuff, what was it called, the leadership framework, but nobody has to do it. So let's have another national one, and nobody has to do it. That's great.
Maybe mandatory, but you know, but yeah.
We don't have to achieve a complete consensus here. We've got different views. Any other things that you think would help health systems, and we deliberately said health systems rather than organisations, get the best from managers at all levels? So that reinforcing that point about working in an integrated way.
I think there's something about where it works really well. You get local, I know it's a phrase that not everybody likes, local health economies or local health systems, but where it works really well, it can be quite powerful having peers, chief executive peers, for example, or director peers working across a health system, across the commissioning, you know, the provision, so-called divide, and specialist mental health and general acute and so on. And I think that can build resilience. David talked about slip, trip, fall, and you know, if there's a member of that band where there's a wobble, then they can help, because I think what we've heard is that actually, you know, we're not oversupplied with, you know, managers, particularly at the senior levels, who are able to cope with the challenges, and therefore I've just seen that what I would call local health economies that are doing better than others are ones where the quality of the relationships across, in between institutions are better.
And so they support each
They
other.
do, absolutely. And they ring each other up and they say, that phrase I've used earlier, how are you okay?
Yeah. Karen, the Leadership Academy is funding these place-based leadership programmes. Do you think that's got some mileage there in supporting those sorts of relationships?
It has, and I think the added advantage is it works outside health, it mirrors much more our patient and service user experience of the totality of organisations that need to work together. And of course, whatever challenges we have working across health organisations, some of whom may be in competition with each other, those challenges are exacerbated when you start working with local authority or other organisations who have very different cultures, very different norms of working. So the more that we can get those people in the same room developing and learning together has got to be an advantage.
Absolutely. Any other thoughts that people would like to see? Okay, let's move on.